Hello, everyone. Thank you so much for helping on. My name is Gradson Onyema. I'm a medical radiography student, my finals. I'm also a medical writer and also a content creator on YouTube. So today I have an amazing guest speaker for Metal Chats. Her name is Dr. Adeola. So, but I'll leave her, to introduce herself to the audience. So, Dr. Adeola, could you introduce yourself to the audience?
Yes, good morning from this end, Ransom, and thank you for having me on your show. My name is Adeola Folorunso. I am the founder of Maternal, which is a non-governmental organization with the aim of impacting life across the spectrum, where we address a lot of global health issues impacting life and the well-being of people. Thank you for having me.
Amazing. Dr. Adiola, thank you so much for introducing yourself. So we have a couple of questions for you to answer. You ready?
Perfectly, yes.
Now, I've followed your journey for a while now. I noticed that you're a nurse, a professional nurse, and apart from being a nurse, you have other varied careers you're pursuing as well. So talk us through in your varied career, which includes nursing, like I said before, health advocacy, and public speaking. What inspired you to pursue a doctorate in humanities and leadership? Talk us through.
All right, thank you for that question. So, to start with, I did not pursue the doctorate degrees in humanity. I was awarded the honorary doctorate in humanities and in leadership. And that was as a result of my 16 years commitment into humanitarian services across from Nigeria in Canada and the United States as well. So I was awarded this by a well accredited institution where they see and they've been following up all on all my programs and activities globally. So that's how I became a doctor of humanity.
Amazing, amazing. That kudos to you for the award. You deserve it because of your varied, careers, especially in the healthcare industry. And I believe that you deserve it more. And I know that there are upcoming awards coming your way. I wish you all the best, Dr. Adiola. So the
Thank you.
second question to you is, all right, as an advocate for global health equity, what key policies or initiatives do you believe are essential to achieving global health equity? Talk us there.
When it comes to equity, yeah, I think we should, take a step back and know the difference between equity and equality. When it comes to equity, equity itself has to do with fairness, justice, while equality has to do with giving people the right to access something. But the difference would then be for equality, for instance, everybody has, for example, everybody has access to wearing a shoe, right? They give everybody to have your shoe on, even if they cannot afford it. But they said everybody come in. But what equity will do, equity is one step ahead of that, right? Equity looks at while everybody is having access to a shoe, it bring into consideration the sizes because everybody's not going to have the same size of shoe, right? It also look at do we have people with disability where we need to modify the shoes that they have to wear so that it fits them perfectly. So there's one thing for you to have access to something. There's another thing for that thing to be modified to suit the need of that person. So when it comes to equity, and back to your question, it will be understanding the people that we want to address their needs. So that's very important. Inclusiveness, whereby the people, the saying that there should be nothing about us without us. So we better be part of the whole discussion and the decision-making process. So when it comes to that policy, when you're making policy about global health equity, the people involved, the people that are going to be directly involved in those, or people that are going to be beneficiary to those activities or program should be included and have a say and empowerment. So that goes to empowerment. And not just only that, when you have included them, you've empowered them, we also want to look at those fundamental principles of factors that might be impacting their lives, or things that could be impacting that quality of life they should be having. And one of it is the impact of the social determinant of health. When we look at the social determinant of the, you look at the social part, the political impact of some of those policies that could be impacting the quality of life of people. And so beyond that, you're looking at education, income, culture, cultural belief system. And culture is one of the things that it's so hard to kind of change, because it is, by definition, it is the way of life of people. So when you want to do address global health issues or bring in global health policies, you better understand the people you're designing or you are making those programs for. Because if you don't understand them, you only assume and you end up wasting the limited resources. So it's important that we look at those factors. Equity, beyond the equity, you're looking at inclusiveness, empowerment, because come with empowerment, the people are more receptive, right? You cannot just take things to people and assume that they will take it from you or they will accept it from you. They need to be, they need to feel, they need to know that they are part of it, right? It is of their own interest. And so with that, you are empowering them, giving them the information needed, and they become more receptive to that policies that you're bringing on the programs. And then it's a win-win for the decision makers and the beneficiaries.
Amazing. Dr. Adeola, thank you so much for talking us through about your advocacy in global health equity and the key policies and initiatives you believe in that are very essential to achieving global health equity. And thank you so much for differentiating the difference between health equity and equality. Now, I love the fact you mentioned about modification, right? We health students are very inquisitive sometimes. So I you mentioned about shoe sizes. People are obligated to wear shoes, but not everybody have the same size of shoes, right? And there are people that are disabled where you have to modify the shoe to suit their their size or whatever. So looking at that fact you said, which is amazing fact, do you think education should be modified for people to people that don't have the capacity to attend or get a quality education to get the access? Is it possible for education to be modified for people that don't have access to education? Do you think?
Yeah, absolutely. Number one, I'm a fan of education. Education is no scam. I know a lot of people have been saying, some have been saying that it could be a scam and stuff like that. Yeah, it should be modified. And now, let's even also take a step back, and understand what is the purpose of education, right? Why are we being educated, right? So if we know the goals of education, then we know what to do with it and what we are trying to achieve with it, right? So it should be modified because, for instance, you look at the geographical location of people. Now, if you're going to tell people that you want to get them educated through virtually, how are the people in the underserved communities or where they do not have access to internet or it's just very poor? How do you think they should be able to access that, right? So you have to understand the geographical location of the people. Also, that's in terms of technology, but in terms of understanding the capacity as well, right? If the goal is for you to educate people to have skills, vocational skills, then you can't be giving too much theoretical aspect of it. It has to be hands-on. So you have to look at, what are you trying to achieve? Are you trying to tell people to know something about where they have to use their hands in terms of like vocational, like I just mentioned, or you're trying to let people understand about policies? So it depends, right? Are you looking at the theoretical strength of location of education rather, or you're looking at the vocational hands-on aspect of education? So you need to understand the people you're dealing with or the people you want to impact knowledge towards, right? And when it comes to the use of language as well, literacy It should be modified. You can't be blowing big grammars and expect people to understand what you're saying, because it's not about the grammar, it's about the comprehension. And when it comes to communication, right, it has to be a two-way thing, right? A multiple way thing where both the receiver and the sender are understanding. And communication will not take place if there is a barrier, meaning one of the barriers could be the use of language, right? The use of technology, the use of assets. So you need to know that, number one, what do we want to achieve with education? Who are the people we want to serve? You should know the people. What are the capacity and the competence? And what is the goal, the end goal of the purpose of you coming to educate people? It's very important. The way you educate people in the urban area should be different from the way you educate people in underserved communities. Not because they have lesser brain, don't get me wrong, but because there are other factors in between that could be a form of barrier. If those things are not addressed, then education might not take place or communication might not take place.
That's right. That's right. Amazing. 100%. Thank you so much, Dr. Dilla, for talking us through on the modification of education, for people that don't have access to education. So, to the audience, I want to hear your viewpoints on how do you think education can be modified for people that don't have access to education in your own perspective. So you could, type into the comment section and let's hear your own perspective. So thank you so much, Dr. Adiola. So the third question for you is, all right, so as your experience as a registered nurse, a healthcare educator, shaped your approach to health policy and program planning. Could you talk us through?
Yes, when it comes to healthcare professional, you're expected to be diverse. You're expected to be on top of your game. You're not expected to know it all, but at least you should know what is needed to be able to provide that quality care that your patient or your clients or healthcare beneficiaries might need. Being a registered nurse and also being a healthcare provider, I'm expected to be up to date with information. And I understand the fluidity or the revolution around, or evolution rather, around knowledge. So, and that's why we have research. And so for me personally, I personally and consciously and strategically place myself in that situation to be able to know up to date information so that I can be relevant in my profession, and not just about me, about the people that I'm going to be serving as well, about the patient, because as a healthcare provider, we're not just the title, we are also people that are expected to impact knowledge. So when I'm, caring for my patient, for instance, I do a lot of bedside teaching ongoing right there. So whether in the clinical level or at the institution level, and also mentors to students, healthcare sciences students, questions have been there. So we need to just be up to date with the information so that we are passing across the right information. Because one of the biggest error in healthcare that you don't want to do is to misinformation. And so we are expected to be up to date with information so that we are providing the evidence-based care and quality care to the patient and even to students and other contemporaries.
Amazing. You see, I love the fact you mentioned about getting up to date, with, providing a necessity for the student nurse as well, your training, like people that are looking up to you as well as a registered nurse. So, could you tell us, there are a lot of latest advances or like latest technologies used in registered for nurses as well, working in the hospital setting or even the bedside. So tell us, when you talked about keeping up to date, there are nurses out there that might be finding it difficult to achieve that task. So talk us through, what are your procedures you're using to stay up to date with your work as a registered nurse and a healthcare educator? Talk us through.
And number one thing is you have to have a curious mind. A curious mind will always want to go one step further. So, out of curiosity, you want to know what is up to date. Number two is to have, and in no particular order, number two is to have passion for what you do. With passion comes expansion because you no longer see your job as a task, but you see it as something you derive joy from. And when you're doing that, you know that the center or the core of the care that you give out is towards the patient. And because you have the passion for the patient and for the job, you want to go extra mile to get more knowledge, more information that will better the lives or the overall health outcome of the patient or the people you're serving. So I see passion and also the curious mind as well, and strategic or intentional, you know, opportunities, looking out for that strategic and intentional opportunities. A lot of times employers provide in-service training, their online programs that are free, looking out for stuff, things like that, education like that, but they must be accredited because there's a lot of information out there. So you may be to be able to screen whether if those information are credible, reliable, right? You don't want to just be putting too much information that is just wasting your brain cells that are not even accredited or evidence based, right? So you're making sure that those information are actually well researched and are credible resources. So strategically looking out for those information. So a lot of people think if I have to like improve on myself, everything is not about money, right? There are a whole lot of information out there. There are a whole lot of platforms that where people can, get those information at free cost. And even with the onset of technology and the embracement of technology, right? You can just access so many information across without leaving your comfort zone. So there is no excuse to improving one's knowledge to impact lives.
Amazing. So if you're a nurse out there, you'll find it difficult to, keep up to that task. I believe that those nuggets Dr. Adiola dropped for us would help you in your journey as well. Thank you so much, Dr. Adiola. The next question for you is, with your experience in leadership and public health, how do you balance the demands of program planning and moderating discussions on global health issues? How do you do that?
They are interwoven. So it's not as if there is, when you're a public health person or personnel, you are automatically a public speaker. You're going to be speaking. You need to be passing information. That's what it means. There are different aspects to public health, but there's a lot of public health is heavily loaded with teaching, impacting knowledge. So it's just interwoven, right? And in terms of me being a moderator, program planning, when it comes to public health again as well, one of the part of public health is health promotion, right? And with health promotion comes program planning as well, where you have to plan. So it's like you have one size fits all approach because public health just encompasses everything, right? So I don't see it as separate, sector because they're all together and indirectly you're doing almost everything.
Hmm, amazing. So, does it mean that your specialization majorly as a nurse is in public health?
Well, yes and no. Public health itself, it's something that it's universal, right? There is nowhere globally, and that's why we talk about the global aspects of public health too, right? So as a healthcare provider, and not just even just as a nurse, as a healthcare professional, you are relevant in the space of public health, right? And there are different aspects of public health itself, right? But currently, I'm finishing up my second master's in international public health, where and it's strategic looking at international part where I really want to address a lot of global health issues, and even through my brand Maternal, that's what we've been doing to reach out to a whole lot of global, addressing global health issues, right? So it doesn't mean that I am, I get stuck to one particular aspect of healthcare, right? But I also major in that aspect as well in global health, or to address things across, right? So
Yeah, amazing. Amazing. Thank you so much, Dr. Adiola, for talking us through. about your experience in leadership and public health in general, and how you balance, the demands of, program plannings and, moderating discussions and on public health issues, which are very vital issues to be talked on. Thank you so much for telling us there about that. So the next question for you is, what strategies? This question is a must hear for the audience. So we would love to hear your strategies you use to engage a diverse audiences as a public speaker and health educator, particularly when dealing with complex topics like health equity. How do you do that?
Well, that's still going to take me back to passion. When you have passion about something, passion is something people would see. You radiate passion. And when you, for instance, when you ask me to come talk about autism, for instance, you can, the passion I have for it is highly palpable. The other person next to me can actually feel it. So even if you don't like it, or you don't even know what it is, what autism spectrum disorder is, the passion and the energy that I bring with it, you'll be forced to begin to love it. You'll be forced to begin to have the curious mind what it is, what is autism all about? Like the energy will so much overpower you, overshadow you, that you have no choice than to listen. So the passion that the speaker of a particular topic or a global health, topic that the person is about to pass on, the passion should show. It's something you carry, and people should be able to feel it. Once the passion is there, it's just easy for you to bring people and gain the consent of other people or the buy-in of people to that topic of discussion, no matter how complex that thing is. You can imagine if I want to talk about a particular topic and me myself do not have the passion for it, right? It's going to show in my body language. I'm just going to be like, my body language is going to tell, right?
Yeah,
Even the whole of my body was just going to be like down. You're right, but you tell me something I love so much, my eyes are going to lead, kind of open, right? And you begin to radiate that energy. And secondly, and I tell people a lot, when you're talking about complex topics in global health, make sure or ensure that you have a full understanding. Go do your research. When you have a full understanding of what you're talking about, it is easy for you to put that thing in a layman's term or language that people can easily comprehend, irrespective of their literacy. So I want to teach on a particular something, for instance. Let me say myocardial infarction, heart attack. I want to teach on that, for instance, and I do not have a full understanding of what that is, or I just have the medical terminology for that, or medical blunder. Oh, sorry, medical, you know, big words for that. I'll use the word big word for that. If I have to go teach about that in the community where people have very low level of educational literacy, how are they going to understand that? I need to come down to the level where people can comprehend. Okay, I'm going to talk about myocardial infarction today, why people have heart attack. And I'm going to start with, now look at the sink in your house, look at the pipe, right? Why is it that why is that water stop flowing? And water represents the flow of blood in that pipe. It's because there are a lot of dirt in the pipe. It's kind of stocked up. A lot of dirt, a lot of things that are not needed that is blocking the water. And so if water is being blocked, then it cannot move to the others, it cannot flow. And that comes in that's the simple terminology when it comes to the flow of blood, where there is no enough blood supply to those tissues, the myocardium, right? Those are the muscles of the tissue. So they are blockage. One of it could be cholesterol, fats, things that the waste that the body is not needing. I have just told you about myocardial infarction in a layman's term, using
Yeah.
the pipe that is being blocked by dirt, waste from food that is blocking it and is not allowing water to flow. And because water is not flowing, so what that means is that there's not going to be supply, and to that supply means there's no supply to the heart muscles that needed, because the heart muscles needs the blood, and blood carries oxygen and carries nutrients, and it begins to die. And from there, there is the muscles of the heart begin to die, right? And you begin to feel the pain. So now tell me, if I'm beginning to use the word
Yeah.
myocardial infarction, using blood vessels, blah, 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 to people in with low very level of literacy, how are they going to understand what I'm going to say? But when I use the approach of the
Yeah, absolutely.
pipeline and the sink, I'm just
Wow.
intending, right?
Amazing.
So having a full understanding and looking at the techniques to help the people understand what you're about to tell them will be very important. And try to kind of modify and have that the skills to which people can easily grab what you want to pass across.
Mm, mm. Because I support that there are a lot of jargon used in medical terms. For instance, that word you mentioned about heart attack, there are different types. You have cardiac arrest. If I want to talk about heart attack, um, to a medical personnel, I don't need to use all those little terms to talk about it, because of the knowledge she has, um, but it's good to, even we the writers, that's what we do. When we write things, we have two things in mind. We have the audience's interest at heart and what they think about that article, because someone, maybe an engineer, can come across that publication, maybe read something on iron receptors in the body. How's the person going to know what iron receptors are all about? Or maybe read something on cardiac arrest. He's not going to understand what you're saying. If you break all those things down, reduce the jargon, use literal terms that is easy understanding, the person can relate to what you're saying. And I love the fact you mentioned about the pipe is totally understandable. And if someone is not even in the medical field or come across this video, could understand what you're saying. And this is also a lesson to other medical professionals out there and medical writers out there. If you're writing something or if you're talking about things related to medical, I think you should reduce your standards. It's very important so that people would really understand what you're saying, so that people will not be lost. They'll just be looking at you. They don't even understand what you're saying, just looking at you. And you think they're paying attention, but they're not, in essence. So,
Maybe
Dr.
not the
Joe,
standard, maybe not the standard, because we have to keep
yeah,
the standard. Just make sure that you have the mindset of the people you're trying to, what is the
yeah,
capacity at which they can interpret those words. The standard
yeah.
should be kept. You don't have to lose the importance of the words or the importance of the message, all because you're trying to oversimplify. But make sure when you
Mhm.
have full understanding of what you're about to talk, what about you're about to teach, then it helps you to be more innovative and creative on how to, pass the message across without losing the standard and the main message.
Yeah. Okay. All right. So we have the last question for you, Dr. Diola. So what advice would you give to future healthcare leaders out there who want to have a significant impact on global health advocacy and education in general? What advice do you have for them?
When it comes to global health, it entails a lot of different aspects. I mean, at a global level, from the name, right? And it entails understanding people's culture and cultural competence, cultural sensitivity, cultural safety, right? But what is mostly important is to be passionate about what you want to do, right? Just don't be carried away by the name global health. I want to make impact in global health. Come back, assess yourself. Is this the right space for you? Right. So you should be able to know what you are passionate about. Because, like I said earlier on, with passion comes expansion. You're just doing more. You're just prepared to give more. But what is very important when it comes to global health as well as a leader too in global health is to become emotionally intelligent, right? Just because we're going to be dealing with different, we're going to be, relating with different cultures when it comes to global health issues or global health, topics, right? The impact of emotional intelligence is very important in leadership when it comes to global health issues too as well, where you understand your own position about something or about a particular topic and what the way other people are seeing things as well. For instance, if we put a number 9 on the floor, to me it's a 9. To the other person over there, it's a 6. We're both right. It depending on the lens at which we're looking at it. So when it comes to global health and leadership, be emotionally intelligent, be emotionally flexible, and try to limit any form of criticism or racism, right? And when I talk about racism of different aspects of, understanding who these people are and why they think the way they think and why they relate to the way they relate, knowing fully well that we do not have the same access, which is very important. It's what we have access to that we are able to make do of, right? So the mental flexibility, the emotional intelligence is very important for leaders coming to the space of global health so that you are not enforcing your position about a particular topic or a particular issue on people, but you are able to see also from the lens at which those people are also looking at it from. And then we can always meet at the middle to make the impact that we want to in the society.
Amazing, amazing. That was a great advice over there. Thank you so much, Dr. Adeola, for your time. So if you love this content, do it to like, share, and subscribe as well. Make sure to watch this session to the end. And you're looking forward to connect with Dr. Adeola. Her details will be, dropped at the YouTube description below. Go over there and just follow her up on LinkedIn. She's an amazing personality over there, and connect with her as well with other platforms as well. So thank you so much, everyone. Thank you, Dr. Adola, for your time and efforts worth hearing.
Thank you for having me on your podcast. Thank you so much.